Thank you very much for joining the session today on water utility experience in COVID-19 response. I'm Norio Saito. I'm Director of the Urban Development Water Division in ADB South Asia Department. COVID-19 situation remains very serious. The total confirmed cases just surpassed 10 million yesterday. The situation is quite alarming in South Asia too, including in Bangladesh. There have been a total cases of more than 130,000 cases, and 3,000 to 4,000 new cases are confirmed every day in Bangladesh. As many of you know well, Dhaka, the capital city of Bangladesh, is a very congested city with large number of population in slums and in low-income communities. So it is not difficult to imagine tremendous challenges that Dhaka WASA, water utility in Dhaka, has been encountering. Mr. Taqsem Khan, CEO and Managing Director of Dhaka WASA, has been extremely busy to cope with this situation. Yet, he has kindly agreed to be with us this afternoon to talk about the challenges encountered, opportunities discovered, and also lessons learned in responding to COVID-19. Thank you, Mr. Taqsem, for joining. We are also very fortunate to have the Honorable Minister, Mr. Tazul Islam, Minister of Local Government, Rural Development and Cooperatives of the Government of Bangladesh in this seminar. Minister will give us opening remarks before Mr. Taqsem, Managing Director of Dhaka WASA since 2009. He is well known to ADB community already, and he visited ADB headquarters in November last year, where he delivered 2 presentations. He led the Dhaka WASA's turnaround program successfully to turn Dhaka WASA into a model water utility in South Asia. Second, today's seminar is not only attended by ADB community, but by external participants as well. As far as I know, we have participants from Bangladesh, India, and Nepal. Senior leaders of the local government division of the government of Bangladesh are joining, as well as Dhaka WASA staff, and also some NGO representatives from Bangladesh. From India, executing agencies of ADB financed projects in Andhra Pradesh, Jharkhand, and Rajasthan are joining. From Nepal, executing agencies related to water supply projects are with us, including former Finance Secretary, Mr. Suman Sharmaji, and also Mr. Miran Shakya, the CEO of KUKL. So KUKL is a water utility in Kathmandu Valley, and probably it's useful to mention that KUKL and Dhaka WASA are closely collaborating under the Water Operators Partnership. Now, I would like to invite the Honorable Minister for his opening remarks.
Thank you very much, Mr. Norio Sato, and all other guests have been joined in this in this very important issue you have arranged to share within the all the other entities and the distinguished. Knowledge sharing about the water utility experience regarding the COVID is very important issue. All over the world is facing this challenge. From the day of beginning, under the leadership of how could we can face this COVID situation. So water hygiene is a very fundamental issue, have been declared by the World Health Organization, and as well as our Bangladesh government have taken it very seriously. So from the day of beginning, we have tried to aware all our people to hand wash as much as possible. Whenever they will touch anything else, or after a few minutes, if possible, they have to hand wash. For facilitating this hand wash, from my ministry, we have a organization for water supplies and sanitation and hygiene, the WASA. And an important organization is engineering department. They are responsible for all the rural areas other than the city corporation for the water and hygiene. So collectively, both the organization was started to work. From the government side, we are giving them the support, whatever administrative support, financial support, and infrastructural facility. So by this way, we are handling the whole situation. And we have set up many numbers of the wash block in many where of the country. And where there is a mass people's gathering, so there also we have set up some sorts of the hand wash system. So and disinfection and other many organizations, they have sprayed the disinfected chemicals in the road, so that all this was that taken. So water, as because water in Bangladesh, we are we can say we are lucky at this moment. Once before 1 decade, whenever our Honorable Prime Minister came in power, so under the leadership of her, the country was start to go ahead. So within time, actually, the water facility was less than 60%. So now we are very actually proud to say that the in urban and rural area altogether 98% above water coverage is here. So the water is everywhere. So we have supplied them the soap and liquid soap and other everything. And in the same time, we because there is a lockdown, you see, to keep them in home and isolation to maintain, and there is a big period we have fast. But despite it, this lockdown, we through the WASA and other entity, we have ensured to supply the water to the home, even because the people's income have been some many where have been shut down, so that even after that, if they do not able to pay the bill, so no entity will disconnect their water supply. So the even but there is a good news is that WASA MD Mr. Taqsem Khan, he has and the WASA of Chittagong and MD both have informed me that the actually revenue collection did not been fall from the normal period. Despite it, we have declared even they do not pay at this moment. They will not pay to. They will not face any compensation. But even after that, they are paying the revenue. So it is one of the good sign, because both that entity, they will be their financial security is there on the source of their own income generation. So the whole over the country at this moment, and there is a despite it there is a industrial consumption is there. Industrial consumption, they are also paying the tax. But honestly, I have to say, Mr. Taqsem is in connectivity, but because from the day of Honorable our Prime Minister 2009 came in power, and he picked up the Taqsem to and give him the authority to build up this Dhaka WASA. And under his leadership, the organization is going ahead according to the requirement of the Honorable Prime Minister. Whatever time goal of water supply has been set up by our country, national perspective, so that he is doing his best to. And there is another good advantage and here, because ADB is our very potential and very remarkable our development partner in many sectors, especially WASA they have given. So for your consumption, I want to point out one thing. Then actually, in the name of the system loss, there is a lot of filterage and many other things was so. But Mr. Taqsem, he has given his input. Because of that, the and the revenue collection and system loss have been drastically reduced. It is very, very, I think, very appreciable in status it is. I think it could be the example of many contemporary countries where there is a, if in case of anywhere else, there is a mismanagement of the water supply and the tariff collection. So all these things, I think, is going ahead. But COVID situation in Bangladesh, you see, where other than you see from the day of beginning, we tried to contain it. Even after all the refugees coming in the airport, we tried to keep them isolation and contain them so that it will not be spread. But actually, somehow it has been penetrated within the country and we have detected, but day by day it is rising. But in Bangladesh, there is a fatality rate is actually 1.3% at this moment. But most of the very renowned people died, which is very shocking to us. But actually, if we go to the case study, we will find that the most of those who are actually very misfortunately they are dying, they have some inherent disease, some other complication within that. But normal people, those who are infecting, they are actually this is very good sign is that they are not actually facing very serious any consequences. So it is one of the things. Bangladesh is very densely country. It could not be compared any other country. Isolation, quarantine, and lockdown. It is very difficult to maintain in Bangladesh because you see huge people, and Europe their density is very low, and America despite all this they are facing challenges to maintain the isolation and quarantine and lockdown. But the same situation is in Bangladesh. But one of the thing is that peoples are courageous, and they are by this time they have been motivated. They have been aware what is the actually how this COVID-19 disease could be spread and they could be contaminated, and so that this is the situation. But everybody is trying to work by maintaining required health precaution. All our health ministry and our local government ministry, all the entity of the city corporation, and even and the remote area village union portion, and everybody is actually all the public representatives very concerned, and the government officials and our army and our police, everybody is participated, and actually formally, informally, whenever our prime minister have given a call, everybody have joined on. And I think everybody in like all over the world, we are also expecting, we are waiting that some sort of detox will come immediately and later or sooner, and then the COVID situation will be over. But first effect facing is a very big challenge, I think, for all over the world, because the whole over the world was not ready for this kind of a unpredictable situation to face. But all these things so that like every other country, we are also planning. We have a disadvantage that the spreading of the COVID is very, very easy in Bangladesh because of density. But there is one big advantage is that first COVID effect, then there is I think there is a good hope for us is that to rescue the country, whatever disaster, whatever consequences we face, because we have a 67% young generation, and all the peoples are very active, and they are working, and still they are working. So agriculture is one of the fundamental of our economy. So the agriculture is very vibrant. At this moment, we have a sufficient food reserve, which is more than sufficient, more than requirement. We have a food. So there is no food deficit. And I myself, being a minister of the local government, I am responsible for the rural communication and urban also in some areas. So that our construction work is not been, I think, it did not been shut down, because it is easy to continue by maintaining the social distance. So we have keep it continue, and because of that, actually our ADB annual development program budget have been implemented very nicely, and we have achieved our target. And this is very, it is, so then, oh, so I think that, so I think Bangladesh, it is a, I think such a country, all the peoples are very much, they're unified under the leader of Honorable Prime Minister, and in all the sectors, everywhere, young people will participate and participate, so that even after that. So finally, before going to conclude my this remark or this space, so I will invite the ADB. ADB is very trusted, defendable, our lender in Bangladesh, in anywhere else. I think Bangladesh is a very potential place, is a very fertile land for lending, and there is a lot of spaces here to be invested in India, in productive sector, productive sector, in the communication sector, rural development, rural communication, water and hygiene, and many where else. We have a program for the 5 sewerage big plant, and all these plants are is under process. So ADB also can participate, and I also thank that the ADB that is immediately you have given the $5 million loan to the Bangladesh, and many other financing option you are discussing with Bangladesh. So I think the relation with the ADB and Bangladesh will remain strong, and we can work together. I think for ADB, I can give you, being a experienced person over the Bangladesh, that it is a these are also the very potential for ADB to invest in Bangladesh, for the which will be beneficiary for Bangladesh as well as ADB, and the cooperation will remain very strong. I think future and relation will be much more strong. Thank you, Mr. Norio. Thank you, and all other you colleagues, and all the guests who have participated in this virtual meeting. Thank you very much.
Thank you very much, Honorable Minister, for your very informative and encouraging remarks. It's very useful to understand the situation the country is facing and the challenges that it has been managing, and also the government initiatives to cope with this crisis pandemic situation. So ADB has been very fortunate to be part of the team to support Bangladesh's efforts in fighting this pandemic. And again, thank you for being with us for this seminar this afternoon.
Thank you,
Mr. Minister.
Yeah.
So now I would like to invite Mr. Taqsem Khan, today's chief speaker, to give us a presentation for about 20 to 25 minutes. So we'll now upload share the screen so that you can control and start the presentation. Thank you, Mr. Taqsem.
Once again, thank you very much, Mr. Norio. It's my great pleasure to be here to give a presentation on South Asia Urban Water Knowledge Sharing Session for Water Utility Experience in COVID-19 Response of Dhaka WASA of Bangladesh. Dear friends, as we all know, that like Dhaka WASA, all the water utilities all over the world is facing a lot of challenges. So we are also. And of course, it is an enormous challenge. And I will now speak a little bit about how we have been able to take care of those challenges, as well as how we have been able to overcome some of the challenges. I give the next slide. Is it coming? Not yet. Okay. Okay. Okay, I think. Oh yeah. Okay. So I'd like to concise my talk on 5 issues, mainly the action and activities that we did, and the challenges we face, like everybody of us, and also the opportunities I know opportunities discovered, because many of the opportunities that we didn't think of it. So I said that opportunities discovered, and obviously lesson learned, and the conclusion and the way forward. So if we take, if we speak on the slide, the actions that we have taken. Okay, yeah, the slide has come. Okay, the action that we have taken is from the 8th March 2020 was the first day that Bangladesh detected the first patient of COVID-19. So from the next day, from the 9th of March, we the Dhaka WASA started taking a preparedness to face their situation, because we are apprehending that very soon there will be a lockdown or sort of something like that. So we got some space there, approximately up to 26th of March. And from the 9th to 26th of March, we made an extensive preparedness. First of all, we did an extensive awareness program by our doctors team. We have a few doctors who have made an excellent visit to all the zones, 10 zones, and all the offices of Dhaka WASA to sensitize the people, or the working people, and to make them aware about the activity, about the COVID-19 and how to protect ourselves, especially the WHO policies, as well as the Ministry of Health policy of Bangladesh, that is what to do and what not to do. Like, as you know, that very frequently wash your hand with soap for 20 seconds, as well as social distancing, wearing mask and everything. So that was done very extensively. So I believe that was also one of the good signs, that our people were being aware that what they have to do and not to do. As well as we have made some of the declarations or some of the office order that all our premises was being was being locked down not locked down, sorry, was being closed for outsiders. Only Dhaka WASA employees were there in the offices, so there was no question of any external contact with the people. All the contact with the people were through virtual, through our 16162, as well as over telephone, over other medias. Then we formed a line of management, whatever we do have, but we made a second line of management. But as you know, that we apprehended if somebody is affected, then obviously not only he or she, but for other people also will have to go for 14 days quarantine or isolation. So what will happen to manage the work there? So we have made a second line of management there. So there is also very effectively work, as well as we have made a very good supervisory team with high officials, and also with the second line of supervisory management, so that in case of any COVID-19 impact on our employees, we can run the show with the second line of management and second line of supervisory management. So this worked well, and this was being, we got enough time from 9th to 26th when the first our country declared the general holiday, whatever, and the lockdown. So that was the preparedness that we took, as well as we use all sort of medical protection that we do have available. We bought a lot of, then we got something also. Then we made 5 programs, and for that we made a 5 program committee. I'll come to that, and that is directly COVID related, as well as it is for us and for all the other people of the city. As well as we have circulated a lot of office order and for banners and awareness, as well as you have already seen, the Honorable Minister, he was very much active and supporting us in all of our activities. So that are the actions that we took to manage to face the COVID-19. The COVID-19 related program, which I said, the 5 programs that we have taken, which is basically the collection and distribution of medical supplies program. We needed all sort of medical protection, or what we call the COVID-19 protective gears. So we bought a little bit, but later we got something from our other development partners. Then we made a DYG program, disinfect your zone program, through water and chlorine water. I'll come to that. Then hand wash program, the production and distribution of sanitizer. That's also one of the programs that we do. And then food or relief distribution program to our LIC low-income community consumers. The first one was the collection and distribution of medical supplies program. Good luck that some of our development partners, especially the Chinese partners, those who are working in our on the Joshua water treatment plant, as well as in our smallest treatment plant, they have the hydro channel. They have imported a lot of PPE, masks, goggles, infrared thermometer, and gloves for us. and we distributed that to all our WASA employees to protect them from COVID-19 pandemic, as well as we hand over a lot of equipments to the to the Ministry of Health, and as well as we distributed something to the private hospital. And this, in that case, also we made a contract with one of the private hospital that in case we have some patient, they will take care of our patient in a private hospital. So also we arrange the treatment facilities if required for our employees. And then we made another disinfect our domes. That was also just spraying water with chlorine. We do have again. We had 10 zones, and we dedicated 20 water. Are you hearing me, right? Are you hearing?
Yes, it's no problem. Yeah, please continue.
Okay. So we modified 20 of our water vouchers for sparkling water, so for giving the water, as well as every day we disinfected 400 kilometers of different roads, lanes, and by-lanes in all over the Dhaka city. This and also we installed a disinfection chamber in Dhaka WASA head office, as well as in many other offices. Here also, you can see in the picture that Hon'ble Minister was present in all our these programs. So that was also inspiration for us. Then hand wash program, as you know, it is very common that everybody has to wash their hand. And for that, we installed some of the hand wash facilities all over the Dhaka city. And also we gave the water tank and the infrastructure with soap, and also refurnished them every morning and afternoon. So that was also one of the programs that we successfully done. And then the production and distribution of hand sanitizer. Our laboratory produced a lot of hand sanitizer for our own employees, as well as we gave it to the ministry, as well as another program we had with the local NGO to produce that, and we distributed to our the Dhaka WASA employees, as well as some of the Kauran Bazaar area, the people those who are living there, the people. Then we had the fifth program was food and relief distribution to LIC, low-income community consumers. And actually, we realized after the lockdown, is after 26th of March. After 1 week of the lockdown, or 2 weeks of the lockdown, we found that people who were living in the low-income community, those were our customers as well. They can't survive after 2 weeks or 3 weeks because they don't have any daily income. So we decided to distribute food for 1 week for them. And that was in some of the LIC or slum areas, 7 of the slum areas, covering 2,000 families. And here also our Hon'ble Minister was with us when we distributed this thing. And we continued that for some time, but later the government started this relief program and we stopped that. And we, in line with the government, we also decide that we then give these food to our employees, later those whose families were being infected by COVID-19. So this program was on, is on scale. Then we carried out all the required repair and maintenance work. It was very tough, but we have been able to do almost all the repair work during the pandemic or during the lockdown period. Then special attention was given for chlorine levels, as you know, that chlorine, excessive chlorine is not good, as well as we know that now it is not been anywhere detected that the COVID-19 is available in the drinking water. But we know that chlorine is also a good disinfectant and crash or kill the virus. So we try to keep the chlorine level at our laboratory extensively. Our microbiologists extensively work on that issue. Then we made the open public ATM water points. Although the country city was shut down, locked down, but our ATM water machine at the beginning it was low. Then we opened it, although it was not economic, but we keep it all open. 184 ATM water points in our pump station, so that the people can take fresh drinking water. Then other operation from the remote monitoring, which has helped us a lot of things. That, as you know, that we do have the people. Many of them we can now operate the startup from the remote, as well as some of them we have to work manually. When we have to work manually, there we have isolated the people. Those who will be working there, only one person was supposed to be there, and no other person is allowed to go there. So by that we made at least to some extent work manually in the pumping station. And all the treatment plants, as you know, the Hyderabad water treatment plant is part of Hyderabad water treatment plant page. These are all very big, big treatment plants of the capacity of almost 225 million liter production capacity. And then we have for the Joshilia water treatment plant of 450 million liter water capacity, production capacity, as well as we have another wellfield plant project. So now what we did, all the people, those who are working in the treatment plant, they were being confined inside. They all lived inside for months together. And all the food and everything was supplied. Nobody was allowed to come out of the, even including our development, including the foreign and the Chinese, then there were some French and other experts who were inside. They all remain inside, all continued and that has helped us a lot. So that the work went on, and there was, and the accommodation was there, and the food was being supplied by Dhaka WASA. And that worked well. And also, as I told, the monitoring and was done remotely by using social media like WhatsApp. We had a WhatsApp group of all the divisions, all the departments, all the offices as a smaller group, as well as we have a management group. And all the meetings we conducted through the Zoom apps. And we solved the complaints of the people of a link, which were excellent. And that's why there was a very less complaint, and whatever the complaint we do have, we have been able to mitigate them. So that was the actions and activities we did. And obviously, there are a lot of challenges we already told. The challenges that we faced are very hard. The general obviously was on the 26th of March. Then, of course, the water production intact. We fight the water pressure as part, not losing any production and obviously the preparedness that we took helped us to keep the water production intact. And monitoring and coordination of employees, which was a very important part, at least not only for the sake of the work, but for the sake of their moral, because that was very important. And as I told, our first extensive program awareness by the doctors helped us a lot, and our people were highly motivated. We tried to encourage and that coordination was everywhere. This is the reason why they were being actually in a crucial situation. They actually working. They worked hard. Then mitigate the complaints of our customers. Of course, it was a challenge because we solved through 16162. Then obviously the health issue of the SCADA operator and pump operator, which I already mentioned, that we had a lot of protective gears and medical equipment that we do have. So also we bought by ourselves, like even now we have bought oxygen cylinders in our medical team, so that if anybody needy, we can supply him at home or in the hospital. So that also we do have a preparation of medical equipments and protection of our employees. Then uses of additional water for frequent hand wash. That's also one of the challenge because people are using more and more water. But anyway, we were able to overcome the situation. Then obviously shortage of labor and materials at the project site at the beginning. Some of the consultants, obviously many of the consultants left the country, the foreigners as well as the locals also. Then the contractors hadn't the proper engineers and technicians available in Bangladesh. The construction works were almost stopped at the initial. But we took over it very quickly. And then the same like the treatment plants in the construction site also, we arrange that the construction workers, technicians, engineers will remain inside the construction site, inside the project, like Gandhapur water treatment project, which is a very big project, like our at present the Dashakandi Swarat treatment plant project. So there we requested the contractor, the consultant had a nice meeting, and they agreed, and they were all confined inside, and the food and other things were being supplied. So I think they were being able to overcome the situation and start their work. So if I have to say that I would say 10 to 20% time we elapsed due to that. Otherwise, we have now regained our production almost. I mean, the development work and the construction work of the projects in almost in full swing. These are the challenges that we overcome and the opportunities that we discover. That's very interesting. So first and foremost, the SCADA system helped us tremendous in keeping running our whole WASA activities. So remote control. That was one of the excellent that we had it, and we utilized it, and it yielded a real good result. Then the government e-filing and EGP means electronic tendering system, which helped us a lot to work from home, from even anywhere. Actually, we among the filing of anything what we write in the files, we have 90 to 95% filing is in the electronic filing. We have no paper filing, except the big international and the development partners project like ADB project, World Bank project, still those are not come under the e-filing. So there we have a manual files to sign. Otherwise, mostly it is e-filing. Then we have tendering process is totally electronic. So hardly we have to do any manual work. So it was being done during the pandemic from home. So this has given us one tremendous relief. Then flexibility in working hours. Obviously, we made a flexible working hours. Most of our employees were at home. They were in quarantine during the lockdown, but they were being asked to work from home as well as, if needed, they have to come to the office. That was the declaration, because although the country was under general holiday, or we call the lockdown, but we, the Dhaka WASA, the water utility, we were on duty. So with the people also of our then enhanced dependency on virtual communication, as you can see now what we are doing here. So we have encouraged people to have a virtual communication. Then we establish smart metering, as you know, so that also helped us. Then introduce mobile banking. Our bill collection system and everything is basically, it was and it is online and 100% automated. Besides that, the banks, we also introduced the mobile banking, which also helped us a lot. Then consumers' motivation to online bill payment, that also helped us to recover the revenue. And also innovative method of collection, motivation by mobile phone, because as you know that people are not, they were not in a position to pay at that time. Okay, so actually, what was the more innovative thing that we, our team, the revenue team, first they started calling everybody from the first month, just to calling every customers and telling how are you. That's it. That was our first, and then the second call after a few days was that if you are in a position, please pay your bill. We are not insisting you to pay the bill, and pay the bill from home through the credit card or through the mobile apps, or even going just outside your home to the grocery shop and use the mobile banking from the bKash and others. So that worked very good, and the customers were really, they did it. And as you can see that in the April, in this graph, that in the month of April, usually, say for example, our income is something like 100 crore. In April that year, it was 4 crore, 4.6 crore. So 5% of the total income. In the May, it was 50%, 50% of the total income. But in June, you can see that we are already overrunning the monthly target. So in general, as already been mentioned by the Honorable Minister, that in general, our revenue collection is not bad. And that also helped us to continue our production work and other works of Dhaka WASA. And then, I'm sorry, I'm 20 minutes, I'm finishing now. Okay, the lesson learned. Yes, that's interesting. What are the lessons that we learned? One of the first lessons that we learned, that we consider ourselves as a digital WASA, because the Honorable Prime Minister Sheikh Hasina declared in 2009 that Bangladesh will be digital Bangladesh. In line with that, we declared that we will be a digital WASA. And now that digital WASA has really worked. So that's what lesson we learned, that our declaration for making WASA as a digital WASA was absolutely right. Then work in challenging situation with less employees to achieve full capacity. That's also has been proved that if the people are motivated, it's possible to do work with a less capacity. Then the positive impact of Dhaka WASA turnaround program, which we declared in 2009 and 10. And this is also has yielded a good result. The people were quite motivated. And in fact, last year, we declared what we call the performance award, equivalent to 4 basic salary of the people. So the people were really motivated. They know that when we have a good time, we're ready to pay. So if we have a bad time, they're ready to serve. So that was also one of the good impact of our, that is the Dhaka WASA turnaround program, where we try to change the mindset of the people. Then automation, online activities, this was extremely effective and extremely efficient. That also. Then minimization of cost and time. I mean, this has minimized our cost and time, and less traffic jam because we were not moving around. Then full-scale digitalization, paperless work. That was also a lesson that we have learned. Then work from home, telework. That is one of the best lessons that we learned. That yes, it is possible to work from home, and that is what is called telework. Then online meeting, seminar, workshop. We are using the Zoom, and with the Zoom, we are having so many meetings every day. So that is also yielding a very good result. So these are the actually the lessons that we have learned from this COVID-19. And if you like to see what is the conclusion and way forward. So one of the things that actually almost we have no hamper, almost, in the production of water and distribution of water compared to any other normal situation. So the crisis management and the normal management, we have been able to rightly make the crisis management to make it as good as the normal management. So that was one of the lessons, way forward, that in future we can, that's the conclusion we can learn from it, and we can go forward with it. Then the revenue income comparatively no change. Oh, I'm sorry. Actually, I don't know why. Who has taken control over this thing? I have a last slide. Please put that back. Can you hear me?
We'll do it. You will do it. Yeah, just hold on a second.
Yes, sir.
Sorry about this. Yeah.
Yeah. Who took the control? Please, the last slide. Give me back the last slide.
It's on the way.
Okay. I'm sorry.
Sorry. Yeah.
There was somebody is taking care of it, so I stopped that last time. This time I was delayed. There was a icon saying stop, so I made it late. No, I have the last slide. Please go to the last slide. Who is in the control now? Please go to the last slide. Okay, I'm in control. Okay, I'm going to the last slide. I don't know whether it will be possible to go to the last slide as quickly. Okay. I'm going. I'm sorry for the inconvenience. Okay. Yeah, the last one. Yeah. So, and then operation and maintenance work and the complaint mitigation, I will say almost 100%. Then digitization, automation, and remote control, I talked, and that is also the conclusion that yes, digitization, automation, and remote control can help us in that. And then what is the main way forward? That need preparedness for the crisis management. We got enough time to prepare ourselves, and we were been able to prepare ourselves. That's the most important thing. We strongly believe that preparedness for that is very much required, and that's what we can take off home. That if any crisis moment comes, then we have to prepare for that. Then the forward-looking leadership essential for crisis management. Actually, all the engineers and our professionals, they were quite motivated, highly motivated, and that gave us a very good result. They were all not only the managers, because our turnaround program, through that turnaround program, it was a reform program, and this reform program, we tried to convert our professionals, our managers, not to be a manager, but to be a leader. And now during the crisis period, actually a difference between a leader and a manager, that during the crisis period, actually a leader can really play an excellent role with his people. And that's what here, I believe our general heads, the engineers, other professionals, our the revenue people, our finance people, they actually yelled or they actually showed that leadership. So I think that's a way forward. I strongly believe that forward-looking leadership need to be made inside the organization for this sort of crisis management or emergency management. So that's I think enough. And once again, thank you very, very much for watching this thing, as well as thanks to Mr. Norio Saito for organizing this thing. I am really happy that he arranged this sort of webinar. So I took 26 minutes. Thank you very much. Thank you, Mr. Norio. To you now.
Thank you, Mr. Taqsem, for a super interesting presentation. And this is very informative and insightful. I learned a lot from your presentation. In the interest of time, there are a couple of questions which I found that in the chat box. So let me just ask these questions to you, Mr. Taqsem. So the first two questions are about the water consumption. So did you notice any fluctuation in water consumption during this because of COVID-19? Like when people went back to villages in late March, did you see a reduction in water consumption? And then when people came back, and then the increase in water consumption? Or because of the hygiene practices, that affects the water consumption? So those are the first two questions.
Frog, Leo?
Yeah, thank you, Mr. Norio. Yes, clear. Yes, at the beginning, when there was, the people were leaving, some of the people left the Dhaka city. So we had a little bit less, consumption. So we have reduced our production as well as at that time. But as soon as people started, washing 10 times to 20 times their hands, we found that that was some increase. But in total, if we plus minus, then it was below the normal consumption of that period of that time. Yes, that was. But gradually it increased. So we decided, and when we discussed, we found that basically it has not much difference. So it was the same, but now it has increased.
Okay, thank you. Next one is a comment. This is from Water Aid. They're commenting on the Dhaka WASA's billing system. So you managed very well the billing system, both sending bill for clients and collection of revenue. His comment is that electricity utilities need to learn from Dhaka WASA's experience. So that was a comment from Mr. Islam of the Water Aid.
Thank you.
Okay, and as a question from Water Aid, apart from setting up hand washing stations, have you undertaken any systematic campaign on hand washing with soap to prevent COVID-19?
Thank you. Yes. Actually, at that moment, what we did, as I told, that we established some of the hand washing facilities, but we had a lot of printing and banner and materials. We tried to sensitize the people. But here I like to mention that yes, I like to thank Water Aid that now we are we know that it's a continuous process. So we are now collaborating with Water Aid to make a project, to make a program for awareness building, as well as practically giving example of how to make the hand wash and to make it a continuous process. Yes, we do have a program, and in fact, we had one with other also with the drink well, but now also we are collaborating with Water Aid.
Okay, great. Thank you. Thank you. Now I would like to invite Manoj for a comment. Manoj, over to you.
Hi, Norio. Good to see you, Taqsem bhai, and colleagues from Dhaka WASA. It's really a great pleasure meeting you virtually, though. I also take this opportunity to convey our regards to Honorable Minister, who has taken time to be part of this webinar. I can see several familiar faces from Dhaka WASA. It's really a pleasure. Thank you very much for the excellent presentation. We have a lot to learn from Dhaka WASA, as usual, one of the best utilities in South Asia. And I'm glad to note that utilities from India and Nepal are also joining this webinar. ADB has been a partner with Dhaka WASA since 2007. So I have a question to Taqsem Bhai. So, and we have supported several projects over these last 12, 13 years. The question is, how have ADB projects over the years helped you prepare for this emergency like COVID pandemic? So thank you once again for the excellent presentation and best wishes for continuing your great success and being a role model for South Asia. Thank you so much.
Mr. Taqsem, if I could just build upon Manoj's question.
Yes.
So, now facing this kind of, crisis caused by COVID-19, in future projects, either financed by ADB or any other development partners, would you like to design projects in a little bit different way to prepare for, to respond to COVID-19 or prepare for like a similar pandemic in the future if it ever happens?
Good. Thank you. First of all, thank you, Manoj. It was really a pleasure seeing you after a long time. And you are also a good friend of Dhaka WASA, worked wonderful with Dhaka WASA and gave a wonderful outcome through you. And now, yes, regarding the question and also supplemented by Mr. Norio, first of all, yes, ADB, truly speaking, has that ADB projects and ADB partnership does have an impact on it, undoubtedly. Because if you look into it, that I told that Dhaka WASA turnaround program, then in different time, different programs, different activities. Obviously, many of the activities were being supported. It's not only that funded, but also supported by ADB people, ADB mission. So that obviously helped us in mitigating this sort of crisis management and emergency management. And the question that you have supplemented, Mr. Norio, yes, a lot of things we have learned. We discovered a lot of opportunities. We like to take those discovered opportunities into work when we will be doing the next project, not only with ADB, but with others. Say, for example, in most of the, now we'll use, or we'll insist to use mostly the automation, computerization, is one thing, as well as we will keep, I strongly believe, I want to keep something for motivation of the people. What I call the converting the manager to a leader. So that's the theoretical part I want to mention. Obviously, we'll talk, we will discuss, and we'll find many other interesting things that will be incorporated in future programs and future proposals of the development of the utilities like us to the development partners.
Thank you.
Okay, thank you. Well, there are now a number of questions. I don't know if we have enough time, but next question is about, is the increase in collection of revenues during June is because of the collection of dues? I think the answer is yes, but maybe Mr. Taqsem can confirm.
No, actually, the increase is basically the backlog. As you have seen, in April, didn't pay. So that was being paid. And also, we try to convince the people, those who are affordable, please pay. So that's also a good sign that the people of Bangladesh and people of Dhaka, they're willing to pay. So that is also a good sign. They are willing to pay if they get good service. That means they're getting a good service. Thank you.
Okay, thank you. Next comment. Thank you for the insightful presentation. I'm curious to know about the using chlorine to disinfect water. His question is, was there increase in the use to disinfectant, and how effective was it to counter the spread of COVID-19? Also, how was washing the roads with water contributing towards the less spread of COVID? That was the question.
Okay. No, I mean, yes, as we know, that this is the instruction for WHO, hand wash, frequent hand wash will prevent the spread of COVID. Now, how far it will have an impact? that's not, I don't know. But obviously, from our side, what is required to do as per the instruction from the WHO and from the Health Ministry of Bangladesh, we did. We supplied the water, and we supplied enough water. There was no shortage of water that people could not wash their hands. So this is number one that we did. And regarding the chlorine, as I told, yes, disinfect we use for cleaning the street also, and also in our water. But I told that so far there is no credible publication in the world that the water in the drinking water there is a presence of coronavirus so far. But as a protection, we try to keep the chlorine as much as possible, which will not be harmful for the people, harmful for the health, as well as that will ensure the presence of residual chlorine, which will kill the bacteria as well as the virus. Thank you.
Okay, thank you, Mr. Taqsem. Now I invite Jimin, another urban director in ADB. Jimin, over to you.
Thank you, Norio. Thank you, WASA team, for your very presentation. And I'm also very glad to know that you really strengthen this tariff collection through this online payment and also this mobile phone payment. So I just have a question. In this Dhaka, there are many people under this poverty line. I just wonder how they can pay their tariffs through this method, because most of them may not have access of this internet, and they may not have a smartphone. Do you have any other method to help these people under poverty line, because they suffer the most in this COVID-19 circumstances? Thank you very much.
Yeah. Yes. First of all, one thing, let me tell you that now the use of mobile phone and the internet in Bangladesh, especially in Dhaka, is too high, which you cannot imagine. Number one, even the people, those who are below the poverty line, they're also using mobile phone, but not the smartphone. Yes, for them, we do have all the avenues open. Even from the internet, you go to the website and you pay through your credit card, debit card, whatever it is. Then you have, you can go to the bank and just tell your number and give the money. Then you can go, you can do by yourself from home by using the mobile phone. If you don't have your smartphone and you don't have your mobile apps for that, then you can go just outside of your house. Almost all the grocery shops or convenience stores, they have these mobile operators connection booth, like Rocket, like Bikash, the name of those two companies. These are very, extensively there are. So those who are absolutely, those who have no access to anything, just they can come from the home and the next door, the convenience stores where they have to go for buying the bread and other things every day. They can just tell them that I want to pay my bill. That's it, and he or she gives the money, and his bill is paid by that system of the mobile phone operator. So there are extensive ways, and in fact, our collection is quite good. Maybe extremely those who are in the slum areas, they might be not paid. Everybody didn't pay yet, but we don't mind. When the time will be okay, they will be paying. So that is not had a very big impact on us. Thank you.
Okay, thank you, Mr. Taqsem. Well, I'm aware of the time, but if it's okay with you, there are a few more questions. Is it okay if we go for like 10 minutes more?
Absolutely okay for me. It's my pleasure. You can continue with the question as much time as you do have. I'm open.
Okay. All right. Thank you. Next question is, this one. Some systematic researches evidences need to be considered about COVID-19 effects on both the water quality and sewage wastewater. Do you have plan to do such researches by Dhaka WASA or in collaboration with academia?
Thank you. Yes, we do have. We had a lot of meetings with our laboratory, our microbiologists. They are also extensively working. They're trying to find out, although we don't have much facilities for testing, but we are also discussing, and we have already almost done with a small research project with ICDDRB. We are already negotiated with small money that we are going to spend from our own revenue money. And we are making a collaborative research on the presence of COVID-19 in water, whereas we know that so far there is no such evidence that there is a presence. But there is a presence already been found that in the wastewater from the human extracts of a COVID-19 affected positive people. There are it's going in the sewage. So that's what we are going to do, a small study on it. Yes.
Oh, okay. Okay. Thank you. Thank you, Mr. Taqsem. Okay. Next question. Do you recommend to use smart domestic meters? And if yes, ADB may advise executing agencies to include this provision in ongoing projects or new projects. So yeah, okay. Question to you, and also maybe to ADB.
Yeah, you know it, Mr. Norio, that we are very much interested to convert all our meters to a smart meter, so that nobody will go to check your meter, and everything we can get in the website, and that will open enormous possibilities of a study, of collection, of people satisfaction. So it has enormous impact. We are trying it, and you know it's a very tough job, but we are trying. So we wish that ADB and other development partners will come in support of us.
Okay, thank you. Next is from KUKL. So are meter readers delivering bills to customers' home, or how monthly billing is done? What about impact on sewage management?
No, first of all, yes, we have still the system that our meter readers, we are trying to reduce that. Meter readers are distributing the bill to the people, although we did it sometime with the other courier service. And we are now, as I told you, as soon as we go for smart metering, there will be no no bill will be distributed. In fact, now there is no need of distributing the bill, because all the bills are available online to every customer. But problem is that mindset of the people that they want a paper. Otherwise, you don't need any paper, because we have already introduced paperless billing system. But the problem is that it is very hard to implement. Maybe 20%, I don't know, less than that people are using that facilities. Rest of the people need a paper. So that's why we distribute it. Regarding the sewerage, we do, you know, we have a coverage of only 20%. Yes, so for whatever the coverage we do have, we are working with it, and it's perfectly okay. Thank you.
But you are still sending the meter readers to the meters of the the individual meters.
Yes, still we are sending. Still we are sending.
But without physical contact to the users, you mean?
Yes, with even some of the meter readers are wearing PPE, which we didn't say that you don't need, but for their own protection they wanted, and we supplied them the PPE. They wear the PPE and went to their customer. Because this also 1-to-1, and 6 feet difference is okay with the mask. So we just told them they just hand over it. Even we told them to just keep it in the box, or in the don't touch, don't talk to the people even for distribution. And during these 2 months, we didn't take the meter reading. We have, on the basis of the previous months, we made the reading was not being checked yet. So now we have started checking the meter reading, because now it's open.
I see. One comment from Tom Panella, the chief of the water sector group, is that the water sector group is working on. Hold on.
Norio, you want me just to...
Yeah, okay, Tom, yeah, you may just come in. Yeah, thank you.
Hey, Taqsem Khan. Thank you very much. This is Tom. I really appreciate your presentation. So Water Sector Group is trying to contact all our clients and come up with a survey to look at how they were affected by COVID and put together a guidance note along the lines of what Norio suggested, how ADB can provide better projects to protect against this in the future. So your presentation was very enlightening, as well as the comments of the minister. But I think what we'd like to do is contact you and your staff to maybe have a discussion offline and go a bit more detail into this. And then not only have a survey, but then some seminars with people from South Asia and the different departments, so managers can talk to one another and discuss how they were affected and how to respond to the situation. And on the COVID detection, we're working on that here at ADB as well. So we can would be interested in your research as well as to share our resources with you on that. Thank you.
Absolutely right. You are most welcome. You are most welcome. We are also ready to support you, collaborate with you, and this is also good for us. So thank you.
Thank you. Thank you, Mr. Taqsem. Thank you, Tom, for the intervention. I think I covered all the comments and questions, but if I have missed, I can open the floor to anyone who wants to make the last minute comments or interventions. Is there anyone who wants to jump in at this point? Okay, yeah, I saw the hand. Milan Shakyaji, yes, over to you. KUKL CEO. Milanji?
Mic off, sir.
Yeah, now we can hear you.
Sir, mic off, sir. Okay. Thank you for your Saito and Khan. Very impressive presentation. I always expected such type of presentation, and it is very resource for all water sector guys, I think. Thank you once again. And in between this lockdown period, we had a talk with Dhaka WASA about what they are doing for this COVID, and we have a certain sharing of Nepal's experience, our experience with Dhaka WASA, and it was quite very useful. And I am very thankful to this water partnership with Dhaka WASA, which is made possible by ADB. So I welcome all the activities that ADB and Dr. Khan initiated today. Thank you.
Thank you, Milan. Thank you. We'll be in touch.
Thank you. For all the participants, today's presentation has been recorded, and also the presentation materials will be available to all of you. So unless there are any further questions or comments, I would like to close this session, but maybe I'll invite Mr. Taqsem for the final words, if any.
Okay. Thank you. Thank you, Mr. Norio and your ADB team, as well as South Asia Urban Water Department for organizing this thing. And extremely, I'm happy, and I found it is very effective and very, I got a lot of interesting questions, and I saw that almost 147 people still there, and yeah, it's 146 present. There was 7. So it was enormous response, and I am sure that Mr. Norio, your invitation has made the people available. And I also got a lot of knowledge out of it, and I'm ready to share again anybody anywhere. And I strongly believe that this COVID-19, we are fighting with the COVID-19, and it's a tremendous job. It's an enormous job, and may Allah subhanahu wa ta'ala support us, as well as all our development partners supporting us, all the people and organizations. We should be together to work and to manage and to overcome this pandemic. So once again, thank you very much, the Asian Development Bank and Mr. Norio. Thank you.
Thank you, Mr. Taqsem, for being with us for this long time. And I want to thank all the participants for joining this session. We have about 160 participants. So that would show the level of interest that we have on what Dhaka WASA has been doing. So this was an excellent presentation, and I really enjoyed the session by myself. And thank you very much. And please stay safe and healthy. Thank you.
Thank you.
Bye.
Thank you. Bye.
Thank you.
Thank you very much.
Thank you.
Thank you. Thank you very much.
Thank you.